Good afternoon. I am Lindsay Peterson. I'm a breast medical oncologist at Washington University and Snippets Cancer Center, and I'm here today with Dr. Jennifer Ligibel, professor of medicine at Harvard University and a breast medical oncologist at the Dana-Farber Cancer Institute. So first, Jennifer, welcome.
Thank you so much.
We're here to talk about your updated results from the BWEL study. So first of all, I think a huge congratulations in order to you and your team for not only completing this study, but you've now seen positive results from both of your initial secondary outcomes.
Yes. So last year at the ASCO annual meeting, we presented data looking at weight loss at 12 months and found that women who had been randomized to the weight loss intervention, and there were almost 1,600 women in the weight loss intervention, about 1,600 controls, that women in the weight loss intervention lost about 5.7% of baseline body weight compared to controls at 12 months. So we were really excited to see that clinically meaningful weight loss in this patient population.
And now we've got more updated results, right, just presented. So can you tell us a little bit about the biomarker data that you just presented?
Absolutely. So there are a lot of questions about exactly how obesity affects breast cancer outcomes. We know that women with obesity have a higher risk of breast cancer recurrence, breast cancer-related mortality, and all-cause mortality compared to leaner women. We believe that at least part of this effect of obesity on breast cancer outcomes is mediated through the unfavorable effects that obesity has on metabolism and inflammation. And so this year at San Antonio, we presented data looking at the effect of our weight loss intervention on key metabolic and inflammatory biomarkers. So insulin, insulin resistance, leptin, and C-reactive protein. We found that women who were randomized to the weight loss intervention had significant reductions, especially in the metabolic biomarkers, about a 25% reduction in leptin, 20% reduction in insulin, and about a 25% improvement in insulin resistance at 6 months. We also found statistically significant but much smaller effects of the weight loss intervention on inflammation. We were also really interested in looking at how did these changes in biomarkers relate to the weight loss that we had reported last year, and found a fairly significant correlation between the decrease in leptin and weight loss, with a correlation coefficient greater than 0.5. The relationship between weight loss and the other biomarkers, the correlations were weaker. And we also finally looked at changes in waist circumference, which is a better measure of abdominal adiposity. And a lot of times we think of the abdominal fat as driving a lot of the metabolic dysfunction that occurs in individuals with obesity. We found that there were correlations between a loss of circumference around the waist and our biomarkers, but the correlations were generally not as strong as they were with weight loss.
I noted that when you were talking about those results. Do you think that is in part due to the measurement error, given that there can be a little bit more variability when you're documenting waist-hip circumference than BMI?
I think that could be part of it. The sites did measure all of the waist circumferences in duplicate, but I think this kind of gets to some of the changes. This was a lifestyle-based weight loss intervention, so patients were exercising, patients were changing their diets, and that obviously was important to the weight loss that they experienced. Tomorrow in the poster session, Dr. Cow from our group is presenting some data looking at the trajectories of exercise, kind of step counts by Fitbit over time. And it's really fascinating to see how different, even amongst patients who had similar weight loss, how different some of the physical activity behavior changes were. So yeah. I think there's going to be a lot more that we study in the coming months looking at some of these predictors of changes in these biomarkers.
Right. Absolutely. Yeah, a lot to learn here. I mean, I think the most interesting thing, obviously, about this study is that the primary outcome is, in fact, disease-free survival, which is a huge feat for a lifestyle intervention study like this. Any hints of when we might get data?
I wish I knew the answer to that question. I think we have almost 5 years median follow-up at this point. So we do think that will probably be sometime in the next year or two. But again, breast cancer, it's an event-driven analysis, so we have to kind of wait and see what happens a little bit longer.
Absolutely. Well, again, congratulations. Wonderful study. Patients jumped at the opportunity to participate in this, and really great to see such impressive results thus far.
Great. Thank you so much. And thank you to all of the patients that volunteered for this study. We could not be here without you. Thanks.